What causes ovulation bleeding and what does it look like?
Ovulation bleeding, also known as mid-cycle bleeding or spotting, is a common occurrence in some women during the ovulation phase of their menstrual cycle. In this video, we will explore the causes of ovulation bleeding and describe what it looks like.
What is ovulation?
Ovulation is the process where a mature egg is released from the ovary, making it available for fertilization by sperm. It usually occurs around the midpoint of a woman's menstrual cycle, about 14 days before the start of the next menstrual period.
What causes ovulation bleeding?
Ovulation bleeding is believed to be caused by a temporary drop in estrogen levels that occurs just before ovulation. This drop in hormones can cause the uterine lining to break down slightly, leading to light bleeding or spotting. Other factors that may contribute to ovulation bleeding include 1. Follicular rupture. When the egg is released from the ovary, the follicle can rupture and cause a small amount of bleeding. 2. Cervical changes. The cervix may undergo changes during ovulation, making it more sensitive and prone to bleeding. It is important to note that ovulation bleeding is generally not a cause for concern and is considered a normal part of the menstrual cycle for some women.
What does ovulation bleeding look like?
Ovulation bleeding is typically light and brief compared to menstrual bleeding. It may look like a few drops of blood, light pink or brown spotting, streaks of blood mixed with cervical mucus. The bleeding usually lasts for 1 to 2 days and may be accompanied by mild cramping or discomfort.
When to see a doctor?
While ovulation bleeding is generally harmless, it is essential to consult a healthcare professional if you experience any of the following symptoms: heavy or prolonged bleeding, severe pain or cramping, bleeding between periods that is not associated with ovulation, irregular menstrual cycles, signs of infection, such as fever or foul-smelling discharge. These symptoms may indicate an underlying medical condition that requires further evaluation and treatment. In summary, ovulation bleeding is a normal occurrence for some women, caused by a temporary drop in estrogen levels and other factors related to the ovulation process. It typically appears as light, brief spotting or streaks of blood mixed with cervical mucus. Although generally not a cause for concern, it is essential to consult a healthcare professional if you experience any unusual symptoms or if you suspect an underlying medical issue.